We wanted to make this video to give you a little bit of familiarity with what the process might be on the day that you come in for surgery if you've been scheduled for retinal surgery. First, you should know that the Georgia Retina Surgery Center is dedicated exclusively to retinal surgery. We don't do cataract surgery or any other form of surgery, and our staff is purely specialized in this particular type of procedure. It's going to be very important that you remember to come in with an empty stomach on the day of your procedure. So that means nothing to eat or drink after midnight, including water or any other coffee or tea or anything at all, not even breath mints or gum, throat lozenges or candy, completely empty stomach except the smallest possible sip of water to swallow any pills that you might need to take for blood pressure or other medical problems. If you're diabetic, you should skip your diabetes medicine the night before the surgery and take half of your normal dose the morning of the surgery. It will be necessary for you to have a physical exam by your family doctor and possibly some additional specialists who will have to certify that you're in good enough health to have the procedure. So there's a form that you'll receive to take to your doctor that they have to fill out and sign and fax back to us before the procedure, and that has to be within 30 days of the surgery. It's also advised that you come in with loose-fitting clothing and slip-on shoes and leave your jewelry at home and avoid wearing makeup on the day of the procedure. You'll receive a call the day before the surgery from our nursing staff to tell you the exact time of the procedure, and you may not have that information earlier because there are often add-ons or emergencies that could change the schedule at the last minute. Now let's take a walk back through the office, back to the surgery center, so you'll have some familiarity with where you'll be on the day of your procedure. While you're in the surgery center having your procedure, your family will be shown into this room and can wait for you here while you're having the procedure, and then we'll come and speak with them as soon as it's finished to let them know how everything went. Once you're brought into the surgery center, you'll come into our pre-op area and meet one of our nurses who will start an IV in your arm to give you some medication to keep you relaxed and sleepy so you're kind of in a twilight sleep where you won't really care what's happening. The anesthesia doctor will give you an injection around the side of the eye like a dentist will give you Novocaine to deaden the area so you don't feel anything while we're working on it. Occasionally we do general anesthesia as well, where a patient may be completely asleep. But for most cases, you'll actually be awake during the surgery and you'll hear some talking, you might feel some touching or pressure around the eye, but you shouldn't feel any pain. And if you do, please let us know and we'll make sure that you get more medication so you'll be comfortable. Now we're here in the operating room. This is actually one of the rooms where you would have your procedure. This is our operating microscope. During the surgery, there'll be either an anesthesia doctor or a nurse anesthetist monitoring your heart rate and blood pressure and all the other vital signs to make sure that you're fine during the procedure. When we're finished, we'll come out and speak with your family, and then someone will escort you downstairs in a wheelchair. And then someone can pick you up at the covered carport on the way out in front of the building, and we will see you the following day in the office. After the surgery, you'll have a patch on your eye. You can leave the patch on all day, the day of the surgery and the night of the surgery. We usually ask people to take the patch off the following morning at home before coming into the office for the follow-up appointment. And we have you start the eye drops in the morning the day after the surgery. You won't need to use any of the drops before the surgery. It's natural for people to be apprehensive or nervous before surgery. And we hope this video may have helped to alleviate some of that apprehension so that you'll be somewhat familiar with what you can expect on the day of the procedure.